Hi there, my name is June. Today I'm going to show you a demonstration of how to apply your sterile gloves and maintain the sterility around them and avoid contaminating them as you are applying them and once they're on. And so I'll talk a little bit about the principles that surround sterile technique, but mostly I'm going to just focus on a demonstration of how to get them on safely without contaminating them. So for starters, I'm going to pull my sleeves up nice and high. I have my table up above my waist, which is one of the principles of sterile technique. Anything below the waist is considered contaminated, so when I apply my gloves, I do want them to be up nice and high. One of the most important things that you should always remember, whether you are using clean gloves or sterile gloves, is that you perform hand hygiene before you put on your clean gloves or your sterile gloves and after you remove them. We do that because gloves are not 100% impermeable. Things can pass through. So we're going to perform hand hygiene before we put them on in case there's anything on our hands that we don't want to pass to our patient. We're going to clean our hands when we remove them so that in case anything our patient passed through those gloves, we're going to wash away. So hand hygiene before and after donning and doffing of gloves. So I've chosen a size that suits me. There are different types of gloves. Most of them are non-latex nowadays. There are still some out there that are latex, so you have to watch for allergies too with your patient. That's really important. And your gloves should fit like a second skin. When you're new to the skill, you might want to choose a size that's a little bit bigger than you just while you work on the skill, but then when you get really good at putting them on, and that takes practice, you're going to want to choose a glove that fits like a second skin to your hand. So let's start by opening up our package. And then I'm just going to unfold that. So that was sterile inside the package, and this part was sterile. It's not anymore. But the gloves inside are sterile, and we're going to maintain that sterility. So I'm going to open it. It opens kind of like a book. You can see we have a right and a left glove. And you can see that it has a fold here. I'm just going to set this down. You can see that it has a fold here. You can see it has a fold here. And then you can see that it has a fold right here. If you look at this edge that's all around, that's pretty much the size of a 1-inch unsterile border. That's another one of our principles of sterile technique. When we open any sterile package, immediately to the outside of that package or field we've set up, there's a 1-inch unsterile border. So we can touch that. We can continue to touch it, and that's going to be important because this package is going to want to slide around at the end of this table, and we want to keep it from contaminating our gloves. So the first thing you do when you open up that package is to unfold the folds. So we're just going to push it back like that. You can see I have it under my fingers. I'm just pushing it back. I haven't opened the final fold, but I'm just unfolding those edges. I'm going to do the same thing on the bottom. I'm going to unfold those edges. And the last thing I'm going to do is I'm going to reach my fingers under those two folds, and I'm going to open them up like that. And if your gloves should ever stick as you're opening up a fold, you can just kind of tap it down and it'll let go for you. Pull open that package and give a little tug. Enough that it'll hold the package open for you. That's why you're tugging it. When you look inside that package, you can see there's a right glove and a left glove. But what's really important to notice is that you can see the thumb is up and there's fingers. Thumb is up and there's fingers. I'm not touching that. That's all sterile. You can see this cuff. This cuff is important. It's folded out that way because our skin is going to have to touch the edge of that cuff in order to pull it on. But when you see this go on, you're going to see how I maintain the sterility of all the part of the glove that we're working with. The next thing I want you to see here is this 1-inch unsterile border where we unfolded it. That's where I can hang on to all the time. I can hang on to this and move it around. I cannot touch anything inside of that line. That's all sterile in there. Okay? So I've pulled my sleeves up nice and high. I have no rings on. You should not have rings on when you're sterile gloving. Your rings are not sterile, and they actually harbor tremendous levels of microorganisms. When you're doing sterile technique, you should not have rings on. and you should not have watches or bracelets on. So, and I've pulled my sleeves up nice and high so that nothing is going to contaminate my gloves as I pull them on. I am a dominant right hand nurse, and so I'll be applying my right glove first. So this cuff is really important. This cuff is where my fingers are going to pick it up. I can pick that up, hold it over the package, and I'm not hurting anything. All of the sterile part of the gloves is still sterile. Okay? So with my dominant hand, I'm going to tuck in my hand a little bit, and I'm going to reach it inside the glove. Make sure your hands are dry, and you can see my hand is sliding nice and smooth, and I'm just going to start to let my fingers and my thumb find their home in the glove. I'm going to maintain this cuff. So you can see me start to pull this on. I've got my hand tilted up to the ceiling so I'm not tempted or going to contaminate my gloves against anything here. Turn your hand up and just let that cuff slide on, glove slide on, and maintain the cuff. So you see how I have the cuff at my knuckle line? I want you to leave that there. Now you have sterile fingers. All these sterile fingers can touch sterile. Sterile can touch sterile. That's the principles of sterile technique. Unsterile can touch unsterile. So this unsterile 1-inch border, I can touch that all I want. It's going to help me hold on to this package. My sterile fingers are going to reach down now, and I need to get my fingers under this cuff. See that cuff right there? So I'm going to just use my fingers and my thumb to manipulate that cuff and get my fingers underneath it. Okay? You can see me picking that up. Don't let your glove come towards that unsterile border. Pick it up off the package and see how I have it. And I'm going to start already to abduct my dominant right thumb away from that glove, because when I'm pulling this glove onto this hand, I don't want that sterile thumb to run down the skin of my left arm and contaminate my gloves. So I'm going to do the same thing, tuck in my left hand, and I'm going to reach it in. I'm abducting my right thumb out of the way. Turn your hand up towards the ceiling and start letting the fingers find their home. And just do a wave. My right hand is just stationary, it's not moving, but my left hand is making a wave towards the ceiling. My thumb over here on my right hand is far away from my skin. My other sterile fingers are tucked inside of that cuff. They're sterile, they're not contaminated, and I'm just going to gently let go. You can see I have that on there, nothing is contaminated. Now I can reach these sterile fingers inside this sterile cuff and do the same thing. Tilt my hand to the ceiling. This hand is just stationary, it's just tugging at the cuff. This hand is making that wave to the ceiling. My thumb is abducted over here so that it doesn't run down the side and contaminate my gloves. I'm just going to gently let go. And I'm going to clasp my hands together right away and think about what I'm doing, because now nothing can touch these gloves except sterile. Only sterile can touch sterile. So it's important to always be aware of where your sterile hands are after you've applied your gloves. And the best way you can protect yourself is to just put them together, keep your elbows out on your chest so that you're not tempted to bring them in here and contaminate them against your uniform or your shirt or whatever you have on. And so just keep them pointed out and together. That's how you maintain your sterility until you move to your skill. And then you go carry on, you have your tray opened and you can work within your sterile field and all you want, because sterile can touch what's sterile. Don't try to pick up this package or anything when you have your sterile gloves on, just leave it there where it is. When you go to remove your sterile gloves, when you've done and completed your skill, you're going to grab a handful in the middle. Okay? Grab a handful in the middle, pull it off, tuck it into your hand, reach 2 clean fingers under your glove, pull it off, and there you go. And that concludes our demonstration of sterile gloving. Thank you.